Jamu, the director of Stepping Stones International. Very good afternoon, Lisa, and welcome to In Context.
Good afternoon, and thank you for having me today.
Right. More than 100 people have been laid off, with 40 given notices. How has that been, emotionally on you as the director, having to deliver such, news?
No, it is absolutely horrible. And we've also had an effect because we also have sub-grantees. So that's just within Stepping Stones. So in addition to that, our sub-grantees have also had to lay off probably between 100 and 200 people. And telling them about this news has just been horrific because you're dealing with people's lives and not just the lives of our staff, but really the lives of our clients. And we serve, for example, we serve 10,000 orphan and vulnerable children in about 10 districts. And so you've had to cut off services to them initially and giving them, making sure that they're taking their ARVs, that they're safe in the household, that we link them to the clinics. And then we've got another 17,604, to be exact, adolescent girls and young women who we've been serving, again, to prevent HIV transmission, to ensure that they're safe, that they're taking PrEP if needed, and we also help their economic, strengthen their economic means. So all of that was just cut off suddenly. And I think that our clients and then our staff, that I have to say we have an amazing staff. Most of them were saying, what about our clients, even before they were thinking about themselves.
Wow.
So I've been really proud of how they've taken it, and we've been also very transparent in everything we've done with it. So, but tough, let me tell you.
But tough, I can only imagine how difficult it has been on you, on the staff as well. And you just giving us a glimpse of what Stepping Stones International is about and the services that it has been, offering to our communities here in Botswana. It kind of gives us a picture of just how heavy the cessation, has impacted your services and our communities here in Botswana. And what are you currently doing right now, minus the aid that you have been receiving?
So right now, we're trying to, take care of our staff. We've given them support with psychology help. We even had a LinkedIn training for them so that they can actually improve their LinkedIn. We are giving them that kind of support because we've trained them. We've trained them in a lot of different of our programs, and so we're losing skills too. We're having a brain drain in some ways. However, even though we've lost the USAID funding, we do have some funding from other donors. So we've had to downscale from 10 to 6 districts. And we are providing minimal services there. And so what we're doing now is really re-strategizing. And as much as, it's a difficult time, I think it's time for us to reflect and to say, okay, how can we become more efficient? What are different means of working with donors, of bringing in the corporate, really looking at how do we create a business model? And a lot of communities and other NGOs from other countries, like the Germans, the Canadians, have reached out to us and said, how can we help? How can we help you fundraise? We've got students in Botswana who are helping us fundraise. So we're really pulling in community and having Botswana take care of their own communities, which is it is beautiful to see that. And it's a positive side of things.
When I first heard of this cessation and coming to the realization that it's actually happening, it was quite a panic. Everybody was panicking. Myself, I was panicking. I was like, oh my goodness, what are we going to do? Because here in Botswana, we have been, I think NGOs have been heavily relying on that US aid for, preventative measures against HIV and AIDS. We're trying to reduce the number of new infections, as the years go by. But then in the same breath, I was like, maybe let's just take this as a positive thing and as a way to now start looking for means and ways to be self-reliant, raise our own funds, and to, stand up on our own feet, right? I want us to, maybe delve deeper into that, different channels that we can consider, that we can, go to in order to become self-reliant, in order to, should something like this happen, should the 90 days lapse and it still sticks, the cessation still sticks, then we know that this is what we're going to do.
Yes, no, I completely agree. I think, first of all, we have to recognize, I do think, and I think that Botswana and the U.S. government have had really good relationships over the years. And we need to thank the U.S. government for what they've done so far. Really, they have made it so that the government has been able to really manage the HIV epidemic and get us to where we are, where Botswana is really a star in showing how we've managed the HIV epidemic. What is worrisome now is with the abrupt stop. Just like that, one day I opened the email, I'm like, huh? What's
it's
happening?
Gone.
Yeah, it's gone. Another day I opened the email and it's terminated, completely. The stop was gone. So, and I think that is a shock. So it's just the abruptness which is difficult, and really trying to think about, and we were working, and the government was working also to say, okay, how can we make this sustainable? And I think it's time for, potentially the government to think, okay, we really need to rely a lot on NGOs too. We kind of are the backbone on the grassroots level, and to really rely on us, vet us, keep us accountable, make sure that, we've done our audits, that we are accountable to what we should be, because they need to be efficient. And then NGOs need to step up and be able to help, and to be able to help in the communities. Right. And then we also have to pull the corporates in and be able to say, okay, we know you're for profit, but how is it that we can work together to help the communities? Let's be creative and innovative in the way, that we work. Is there a way that we can have hotels get their customers to, provide support? Is there a way that corporates, we're looking at having corporates help us redesign it and make us run like a business.
Right. Include this in the, social corporate responsibility.
Exactly. It doesn't always have to be funding. It can be volunteers. We want community to come in and say, okay, we'll provide snacks for one of your sessions today, or have a corporate adopt a district for us, or adopt a program. Education, health, and say, okay, we're going to adopt this program. What do you need, and what can you put in too? Right. So I think we got to think differently, innovative.
Right. Think differently, because a lot of times, when we're thinking money, finances, we're not thinking about other means and other things that we could put on the table and bring together to make it work.
Yes, absolutely. Really have to be creative.
Have to be creative. Now, back there, Lisa, you did mention a couple of things that Stepping Stones International has been doing and how big of an impact it has been making on our communities. You said 10 districts that you had adopted. I'd like for us to talk about deeper into what Stepping Stones has been doing, just so we understand, the impact that it has had, and that, if somebody's watching right now and could possibly want to pick up from where the US aid has left, SSI, and come on board and help it advance its mandate.
Right. No, and it's a really good question. So we do a lot, and we have kind of a model where we not just help the child or the young person, but we help the child's community, we help the child's family, and at a national level, we have child protection. So a lot of what we do is empowerment, and we've had, you may have heard about the Dreams National Program working with adolescent girls and young women. And we have safe spaces where we talk to them about their real issues. We build their social assets. We link them to clinics. So we're kind of like that linkage between accessing healthcare and what their needs are of the client. And then we also do a lot of income generation activities with them. And they can decide on a path. Do I want a career? Do I want to be able to start an entrepreneurship? And we have a program called Finding the Leader Within that we do with them. And there we do pull in corporates. They will often take them as interns and oftentimes hire them because they've been groomed, you know, to be able to be in the workplace.
Wow.
And then at the family level, we have a parenting program where we work with the parents and teens, and they come together in sessions. And we talk about, you know, how to communicate better, how to even build your own budget together. And it really has had impact. We've actually done research on it, and it shows that there's higher communication, there's budget building together, that there's reduced alcohol abuse in the families because of this. So it has really shown impact. And then, of course, we work with the households. We go to the households and, again, link them to the clinics, link them to social services, provide counseling to them. And I think with that all gone, it's kind of it's a big loss, you know, not to have that linkage and that support on the ground. And of course, with our sub-partners, we have them going out and doing HIV testing. We have them now, we were just starting to do non-communicable diseases, because that's also rising in Botswana, your diabetes and hypertension. So with that all being gone, you know, the government can't do everything, and they need that support. And so that is where, yeah, it's difficult. So I think that those are the gaps we need to fill and to be able to kind of move on.
Right, and those are all those programs across all 10 districts?
Yes.
These are all programs that build a responsible adult.
Yes.
You know, great leaders to come. And I truly do hope that somebody's watching right now and is thinking, let me jump on board and, you know, help SSI be able to advance its mandate. All these programs have been stopped, or are there some that are still running, but at what scale?
I think, like in the districts where we have minimal other funding, we're still continuing with that. Our Finding a Leader Within has been going for 12 years, and it will continue, come high water, you know. But I think, you know, some of the examples, like you can't take away, we talk about programs, but we forget the people behind them.
Right.
And this past weekend for Women's Day, happy Women's Day late, by the way, I was talking to one of our former participants, she went through our program in 2019, and she's a YouTuber now, and she's written her own book. Wow. Another one of our participants who went through the program went to France and was able to go through a scholarship in France. Another one became a manager at a hotel, at a cafe, excuse me. And so I just think that there's so much. Others have, you know, been able to get the courage to go and report gender-based violence. Others have been able to take their cases to court. So there's just so much that I really feel that there's going to be a big gap if we don't fill that. But we will. I will. And my team is dedicated to doing this. The passion is there.
The passion is there. And stay optimistic through it all, right? Because these are just all amazing programs that a young person needs, a young girl needs, a young boy needs out there. And it helps kind of break the cycle, you know, these generational cycles like you're talking about. I heard you mention something about alcoholism in the family back there, and, you know, it helps break all of these generational cycles. And my God, my goodness, Lisa, that's just amazing work that, you know, you have been doing. And we did mention there at the beginning that you're short-staffed right now. How are you able to, you know, continue offering some of these services that you have been offering, having, you know, your staff being stretched so thin?
It is difficult. I have to say, though, whatever the culture is at Stepping Stones, it's really coming out right now, because even though we're short-staffed, they've actually become like, let's do this, you know, and had the vigor behind it to be able to do more. We've, you know, improved our programs. We want to make sure that we're providing for the children who we still are serving the best quality services. We don't ever want to let our quality, you know, go down at all. So I think that passion, that culture that we have at Stepping Stones International is still there. And we will serve our children, and we will continue to serve our communities in any way we can. And we really, like, what is also sad is those partnerships we've had with the DHMTs, with the chiefs, you know, in those villages, and you create trust, you create a reliance on each other. And I think that's what's also difficult. But we've told them, you know, call us if you need us. We'll still support you, even if it's a phone call to ask advice or something like that. So it is heartbreaking, but we are going to keep those relationships going. Ethically, if there is an emergency situation in any of those districts that we have pulled out of, you know, if it's suicidal or if it's something to do with HIV defaulter or things like that, or we do answer those. I mean, we're not going to let people, you know, go.
And this morning we did hear, you know, the Vice President of Botswana, make mention of, you know, the impact that this cessation has had, and that as government and all stakeholders really have to forge a way forward in order to see that we become self-reliant.
Yes.
You know, self-sufficient in order to continue all of the amazing work that organizations such as yours, you know, are able to continue doing what they do. There is hope. Can we say that there is hope? You know, seeing that government is quite intentional in finding whatever means possible to help advance every, you know, thing that you have been doing on the ground.
Absolutely. Don't ever lose hope. Yes, absolutely. And I do feel that it's got to come from an individual level. It has to come from a community level, and then from the corporate sector, and then from the, you know, the government, and then obviously the NGOs. So I think all of us play a part, even at your small little, you know, self level. It's not really small, because if you add up all the smallness, it adds up to greatness.
To greatness.
And so I think it's really important that everybody plays a part.
Right, right. Well, that is all the time that we did have today, Lisa. Thank you so much for joining us.
Thank you.
Of course. There we have it. That was Lisa Jamu, the director of Stepping Stones International, on the topic of what they are doing as an organization right now following the cessation of U.S. aid to, you know, especially in the health sector. And as Lisa said, never ever lose hope. This is an indicator for us to stand up and become self-reliant, find different means and be creative with how exactly it is we can be able to continue the mandate of all of these NGOs that have been doing a wonderful job on the ground. Stay tuned for the news at the top of the hour.
Bagaitso, hurt people will hurt other people. So let's break the cycle of violence.